Our patient is a 33-year-old male who presented to the office for a new patient assessment. His biggest concern today is worsening anxiety symptoms for the past 3 months, and he's also had worsening depression symptoms. He has a history of depression. He was started on Wellbutrin 300 milligrams once a day in the morning about 5 years ago, and that has worked well up until about 3 months ago when his depression and anxiety symptoms were increased. We started him on amitriptyline or Elavil. This medication is FDA approved for treatment-resistant depression, as it can also be an adjunct to other depression medications. It also is off-label for anxiety. It is also prescribed for irritable bowel syndrome at lower doses. It is classified as a tricyclic antidepressant. CYP interactins, amitriptyline is metabolized by the CYP2D6 enzyme and interacts with lots of medications that either inhibit or induce the CYP2D6 enzyme. Drugs that inhibit CYP2D6 are fluoxetine or Zoloft, and paroxetine or Paxil. That may increase the levels of amitriptyline as it does inhibit the enzyme and can lead to toxicity. Medications such as rifampin for liver failure may decrease the amitriptyline levels, as that is an inducer of CYP2D6 and can reduce the effectiveness of amitriptyline. We started the patient on 25 milligrams. The starting dose of amitriptyline for depression is 25 to 50 milligrams per day taken at bedtime. Medication can be sedating, so that is why it is encouraged to take at bedtime. There are higher doses that are prescribed for more treatment-resistant depression, but the lower doses, such as 25 milligrams, is used for anxiety. But doses can go all the way up to 150 milligrams. As I said before, a primary care, a GI specialist, may also prescribe amitriptyline for irritable bowel syndrome at the lower doses of about 10 milligrams. Amitriptyline is a serotonin and norepinephrine reuptake inhibitor, and increases the levels of serotonin and norepinephrine in the brain. It works to improve mood, feelings of well-being, and relieve depression symptoms. Sorry, my whole house has COVID right now, including myself. Anyway, when prescribing to a patient, I would make sure to go over all of their other medications they are on to see if there's any of the interactions that we just discussed, as well as I let them know that the medication, what is used for. So we're prescribing amitriptyline today. You're going to take 25 milligram tablet once daily by mouth at bedtime. The medication can make you tired, so that's why it's encouraged to take it at bedtime and before you go to bed, when you're all done, ready for bed, and you're about to sleep. Don't take it on your way home from a friend's house or things like that. Make sure you're at the place you're going to sleep. It can cause, like I said, drowsiness. It can also cause dry mouth or constipation, dizziness, weight gain, difficulty urinating, increased heart rate, low blood pressure, or fatigue or weakness. Those are the more common side effects. Less common side effects such as seizure, rash, irregular heartbeat, hallucinations, confusion, sexual dysfunction, and increased sweating. Those are less common but can still occur. Serious side effects you need to know about. They are more rare, but these are side effects in which you would immediately seek medical attention. If you have any suicidal thoughts or behaviors, at the beginning of the treatment, this medication will give you some energy during the day because you're starting to feel better. But any of those thoughts need to be reported. Any worsening depression, like we just talked about, any mania, uncontrollable movements, difficulty breathing, severe dizziness, or allergic reactions need to seek medical attention immediately. This medication may take a few weeks to work and relieve your depression symptoms, so I want to see you back in 4 weeks and see how you're doing.